and join us as we progress. Good morning, everybody. Thank you for joining. For those of you that don't know me or have not come to one of our webinars or events before, my name is Sam Cronin. I lead the healthcare activities of the UK Israel Tech Hub, a UK government team operating out of the British Embassy in Israel that works with British multinationals to help solve their innovation needs and challenges using Israeli technologies. Of course, in healthcare, I also work a lot with the UK's National Health Service, which is the largest healthcare provider in the world. It covers about 60 million patients. It is overburdened, underfinanced, in desperate need of innovation. Just to give you a bit of background on our team, in about 8 years, we've built more than 200 concrete partnerships between the UK and Israel, with a total deal value of about £100 million and an estimated impact to the British economy of about £1 billion. If you're an Israeli startup and we don't know each other, please do feel free to reach out and we'll find some time for a virtual coffee. Just to give a little bit of background on this series, as you're aware, this is our titled Not Another COVID Webinar. This series came together because, well, as you all saw, the ecosystem is inundated with a lot of webinars, a lot all related to COVID, the future of healthcare, COVID this, COVID that. But the fact of the matter is that if you're innovating in healthcare, the chances are that you've been innovating for a long time. Healthcare is a very slow game. You were doing it before COVID, and COVID has probably, apart from being, a bit of a pain, has not really changed too many things for you. And so given that part of my job is to support the UK's National Health Service with Israeli innovations, I need to do my best to ensure that you, the entrepreneurs, have access to the information and knowledge that you need. So we've been running this series of webinars for the last month or so on varied subjects such as data privacy, clinical evidence and regulation of technologies in the NHS. And this morning we are joined by Sharon Steele, who will be speaking about how to navigate the NHS and the flow of money in the system. So without further ado, Sharon, please take it away.
Hi everybody, good morning. Thanks for joining me on the webinar today. First, a quick introduction about myself and about the webinar, and also thanks to Sam. Sam, first of all, before you go, just thank you so much to you and the team at the UK Israel Tech Hub and the team at the British Embassy in Tel Aviv for inviting me to present this morning on what is really a very practical webinar series. I just wanted to say at the beginning that in the strange times that we're living in, I do find it difficult not to be seeing your faces. I much prefer face-to-face meetings, but obviously that's not possible. So I will try and make this as engaging as possible. But obviously I can't check your understanding so easily or see your body language. So do please, if you have questions, keep them coming, write them down in the Q&A or fill in the chat box, and Sam and the team will have a look at that throughout the presentation. I am going to try and take the questions, if you don't mind, at the end, because there's a lot of things I want to share with you, which I think are really practical and which I think you should know. So I'm going to try and get through to the end. Hopefully, you will all have understood all the information that I am going to share, but if not, as I say, put your Q&As in the facility and I'll take them at the end. And if I don't have time at the end, I will leave you with my contact details, and please be in touch after the webinar. My slide set will be available to you also, and at the end of the slide set, I'm not going to show you that during the presentation, but there are some links to some resources. I can only give you a very top line overview of the NHS and the UK health and care sector this morning, but there are many more resources available to you, and indeed if you visit my website, I've written a short booklet or a document which you can download and which will give you much more top line information. So you'll get that on the last, or be signposted to that on the last slide in my slide pack. So let me tell you a little bit about me and why I'm here talking to you today. So I actually relocated to Israel last year after a career in the UK health and care sector. I've spent my life there, and I'm working now as a specialist UK healthcare advisor to companies that are wanting to sell or scale up in the UK health and care sector. Before I came to Israel, I started off my career in the NHS. I was a registered clinical pharmacist working as part of a multidisciplinary team with doctors and nurses. I've worked in hospitals, I've worked in care homes, I've worked in hospices, I've worked in general practitioners, or you call them here family doctor surgeries, and providing clinical services. And I worked my way up through the NHS ranks to become a senior NHS manager and also a postgraduate trainer. And after gaining my clinical and managerial expertise and experience in the NHS, I actually co-founded my own independent company to supply clinical services and educational solutions to the NHS. So I'm presenting to you today both having been on the inside of the health and care sector in the UK, and also as a supplier to those public funded organisations. We enjoyed over 20 years of NHS customer loyalty. So during that time, I have become really expert at how to navigate the sector. So that's a little bit about me. And I just wanted to also finally say to you, I know the title of the webinar is Show Me the Money, Navigate the NHS. In order to navigate the NHS, you really need to have a good understanding of the whole of the UK health and care sector and where the NHS really fits into that. So I'm going to be talking wider than the NHS, but it will be a very top-line presentation. Okay, my two top tips and tricks for success with your strategy is understand where you fit in and invest in a bespoke UK strategy. Now, I'm going to build up my whole presentation to support those two top tips and to give you the knowledge that you need. But what I would say is, in the time I've been in Israel, I've talked to quite a lot of people, quite a lot of startups, quite a lot of companies. And what a lot of people have said to me is they've fallen into the trap of using a market strategy that they developed for the US market in the UK, and it doesn't work. So it is really important that you do understand where you fit in, if you fit into health, if you fit into care, or if you fit into both. And then you really need a tailored, a personalised approach to how you're going to deal with the UK markets. So health or care or both. These are just a few examples that you may well have heard of around companies who have had, or Israeli companies that have recently had success in the UK. Healthy.io, working together with the NHS, both in England and Wales. IBEX, a recent partnership, so IBEX Medical Analytics, a recent partnership with a private healthcare provider in the UK, and Essence, who are working in partnership in the care sector in the UK. So there's some exciting things happening now, even despite COVID, and it is all really, really possible. So I'm going to start with some UK health sector basics. I'm sure that most of you listening will be aware that in the UK, we have a public funded universal healthcare system. That means it's free at the point of delivery, it's funded through taxation, and it covers the whole of our population of around 66 million citizens in the UK. It's the biggest healthcare sector in the world, one of the biggest, or the biggest, I think, employer in the world. The government spends a lot of money on the NHS. In 2018, the size of the spend was around £167 billion, almost 80% of the total healthcare spend. And you can see, I think, that other than the NHS, the remaining healthcare spend, the remaining 20-odd% in the UK, is delivered either by the private sector, we call it either the private or the independent sector, I'm going to use those words interchangeably, or what we call voluntary or third sector organisations. And I'm going to talk about those a bit later on as well. Something that I've discovered meeting people in Israel is that they're not always aware that in the 4 countries of the United Kingdom, so we have England, Scotland, Wales and Northern Ireland, there are actually different NHS models, different legislation and different professional guidance in those different countries. So when you are developing your strategy, you need to be very clear about the country within the United Kingdom that you're targeting, and you may need to have adapt things accordingly. And lastly, understanding the sector organisation is really critical to finding out who holds the money and where you're going to find most success. Now, this is a really busy slide. I don't want you to get too involved in the detail of what's written in all of the boxes. It originates from some work that was done by the King's Fund in the United Kingdom. The King's Fund is an independent think tank. And they developed this organisational diagram a few years ago now, and I've slightly updated it and put some sector organisation groupings in here just to kind of explain it and hopefully make things a little bit easier to understand. What I want to say right at the outset is, having just told you that there are 4 countries in the United Kingdom and they all do things in a different way, most of my comments going forward in this presentation are going to be about the situation in England because it's the biggest country. Okay, so this diagram talks about or shows a picture of the health and social care sector in England. You can see the UK government here funds the whole of the sector, that's health and social care, through one government department, the Department of Health and Social Care. Okay, and we've got these different groups of organisations. Now, if you just look here at this column, then I have grouped these organisations to make hopefully life a bit easier to understand into 4 main groups. I've called them influencers, commissioners, service providers and sector transformation organisations, and we're going to talk about each group in a bit more detail. From this diagram, the take-home message is simply the influencers here are this group here, all these agencies and public bodies and these regulators. The commissioners are people that buy services for the population, health services and care services. They're this group here. The service providers are this group here, and that's health and care service providers. They actually deliver services to the population. And then we've got these sector transformation organisations, and these are really important because change is afoot in the United Kingdom, and you really need to be aware going forwards of what is actually happening. Now, there isn't a group on this diagram because this diagram actually shows what the situation is now in the UK, or in England, I should say, but these sector transformation organisations appear here. This one is called Sustainability and Transformation Partnerships. This one is also appears in this category, Integrated Care Systems. And there's also a GP grouping in primary care called Primary Care Networks that you'll see appear in this category here. So these are all changes happening. You need to be aware of that. And we're going to talk about those in a bit more detail. So just take away from this slide 4 groups: the influencers, the commissioners, the service providers, and the sector transformation organisations. Oh, missed one. Okay, so let's first look at what I call the influencers. These are important because the first 2 groups, the regulators and the policymakers, they should affect your market strategy at a very early stage, whereas the enablers are going to affect your strategy later down the line. I'm not going to talk about regulation in this webinar because it was covered in an earlier webinar in this series, but you are probably aware that the Medicines and Healthcare Regulatory Agency regulates medicines. It also regulates medical devices and blood transfusion products for the United Kingdom, and the Care Quality Commission regulates basically everything that we do in health and in social care practice in the UK. So they're just 2 examples I've picked off of regulators that you should be aware of, but I'm not going to explore any further today. A word about policymakers. We have loads of them in the UK, and we have loads of them in each of the 4 countries, and these are examples of important policymakers in England that you should be aware of. NHSE stands for NHS England. This organisation basically leads the NHS, but is also a national commissioner, and we'll come back to that. I hope you are aware of NICE, and this was again covered in the first webinar in the series. NICE is the National Institute for Health and Care Excellence. NICE was actually set up to make sure that everything that we do in healthcare represents value for money to the taxpayers in the UK. So, I mean, I'm sure you're aware that culturally, the NHS is a bit of a national treasure. Everybody that works in the NHS, you know, all our citizens, everybody loves the NHS, and everybody wants to do the best with the limited resources we have. So NICE was set up with that in mind, to ensure that we deliver value for money, which means that from your point of view, you need to be in a position, if you are wanting to supply into the NHS, or in fact the health sector in the UK, that you create enough evidence and high quality evidence in line with the standards and guidelines produced by NICE to ensure that you can demonstrate that your products or your solutions or your digital tech does provide value for money. And on the subject of digital tech, IT solutions, anything medtech orientated, you do need to be aware of NHS X and NHS Digital. Again, in my travels around talking to people in Israel, I wasn't aware that people were familiar with these organisations, but they do set the standards for anything related to medical technology, to information management, to digital in the NHS. So you do need to be mindful of these and make sure you adhere to national policy in those areas. And these last 2 organisations, which I want to flag up here, are around upskilling our workforce. HEE stands for Health Education England. Health Education England is responsible for training all our healthcare professionals, postgraduate and undergraduate training, and Skills for Care is responsible for the standards, if you like, for training our care professionals. So in my practice, one of the things, you know, in my kind of all my years of supplying services to the NHS, I've always taken an educational approach to whatever service or whatever solution I'm providing. So if you are intending to supply any new technology, any innovation, any new devices, then it's really important to make sure that you do upskill the users and the professionals that are going to be using your products. And in providing that training, again, it's important to be aware of standards set by Health Education England and Skills for Care. And lastly, this group, the enablers, they are the people in a way that are there to help you test and scale within the UK, in this situation, the 2 organisations I flagged up in England. It's really important that, as well as having evidence about the efficacy and the safety and the value for money of your products, that you actually have some local evidence in the local population. And again, these companies, Health Tech Connect, Academic Health Science Networks, can help you test and scale. So that's the first group of organisations, that's the influencers, and they really do need to influence your market strategy. The next group are the commissioners. These are the people that buy services for the local population. They buy health services, they buy care services. There are 3 subgroups of commissioners here, and really it's quite easy. I've grouped them by the size of the population they buy services for. So we've got NHS England here. NHS England buys, it's not a big commissioner, but it does buy services for the national population for certain rare diseases, unusual cancers, for example. Then we have regional commissioners who buy services across a regional population in England. And then we have two types of local commissioners. We have clinical commissioning groups, of which at this moment in time, there are 135, but watch this space because change is afoot. You'll hear in a few minutes. And we have local government authorities or local councils, of which there are quite a large number, that buy social services or social care services for their local population. Now, it's important for you to understand how commissioners do buy services and why this is important to you. So the first and important thing to understand is that they buy services in line with priority needs in their local area. The government, through NHS England, in England, has set out the national healthcare needs for the whole population of England in a document called the NHS Long-Term Plan. That document was published in January 2019 and basically describes all the targets for improving the health of the population in England. But that necessarily doesn't translate to every different area in England. So each different local area will have slightly different health needs and health priorities. And what commissioners do is that they look at the local population, they look at lots of different data sets, and they prioritise what they think is important. So if, for example, in the southwest of England, where there is a predominantly elderly population, there might be an increased need or an increased priority to improve the performance of stroke services, for example, or to improve the diagnosis of some of the cancers that are more prevalent in an elderly population. Whereas in an inner city area where you might have a younger population, then the priorities are going to be different. There might be a higher need, for example, of unwanted pregnancies or sexually transmitted diseases. So the targets that each area, each commissioner will choose will be relevant to their local population. And they will set goals basically for improving health outcomes in their population. So why is this relevant to you? Well, the most important thing here is that if you can actually light up the way and open the imagination of commissioners to the potential of your products, your technology, to actually improving the outcomes in their local area, then you will create demand for your products and services. So it's really making sure commissioners understand what you can do for them, how you can help them achieve the improved outcomes that they want in the local population, and that way create demand for your products and services. So that's the second group, the commissioners. The third group that I want to talk about quite quickly is service providers. These are people that are actually going to deliver healthcare and social care on the ground to their relevant populations. I'm going to talk first about healthcare providers, and I'm going to talk about them in three different groups. Those in the NHS or NHS-related groups, so the NHS family of organisations. Then I'm going to talk about independent providers, and then the third sector that I mentioned before. So in this group, NHS-related healthcare providers, we have NHS trusts, and that is basically hospitals. We also have ambulance trusts, mental health trusts, and we also have community trusts. And we also have primary care practitioners. Now, these are four groups of healthcare professionals, doctors, and we call them general practitioners or family doctors, pharmacists, community pharmacists, dentists, and opticians. And these groups here, these primary care practitioners, these are all independent contractors. So they're kind of, if you like, independent businesses that provide services under contract to the NHS. Now, the NHS trusts themselves and the GPs in this group, when they buy products, they need to go through NHS processes we call of buying products, and we call that NHS procurement. And I'm going to have a quick word about that a bit later on. But basically, NHS procurement, you may have heard, is quite complex. You do need specialist advice about how to go forward with NHS procurement. But what I would say to you is that these primary care practitioners, certainly the pharmacists, the dentists and the opticians, because they're independent practitioners, they will often have less complex systems of buying products and services. So if you are wanting to kind of, try things out in the UK, and your product, is relevant to either the pharmacy sector, the optical sector, or the dental sector, then it might be worth going down this kind of route here. And as an example, I'm just going to spotlight for a minute or two on the community pharmacy sector, and for a couple of reasons. It's quite a big sector. There's a lot of potential, and things are changing here, and this sector is actually being quite creative at the moment. So you can see it's a big sector, a lot of money is spent here, and there are a large number of premises across the United Kingdom. The sector is organised into 3 subgroups. So community pharmacy, we have large chains of community pharmacists, some household names, you might have heard of 1 or 2, and that does include supermarkets in the UK that have chains of pharmacists within the supermarket sector. We all have small chains or small multiples, and some independent community pharmacists or pharmacies, which are single businesses. They're open long hours, 7 days a week, and they're often centred right in the heart of their community. They provide, as well as dispensing medicines and selling medicines, they provide health and well-being services. And the community pharmacy sector in England is moving towards providing much more clinically focused services than is the situation in Israel at the moment. So pharmacists, if they are skilled to do so, may be independent prescribers in their own right. If they have the appropriate training and qualifications, may be undertaking clinical assessment, they may be actually doing some kind of diagnosis, and they certainly may be doing some kind of monitoring for high-risk medicines. So we're kind of moving towards a much more clinical service provision in the community pharmacy sector. And pharmacists are also using their premises in a very creative way. So the huge number of premises. And a recent example of this is Asda, one of our big supermarket chains in the United Kingdom, has partnered, they have a big pharmacy chain as well, and they have also partnered up with a digital primary care service to offer in-store GP video consultation. So they're using their premises really creatively, so that when you go and do your weekly shop, you can see a GP, have a video consultation, and get your prescription dispensed all at the same time, all in the same session. So an interesting market to watch out for. The second in my subgroup of healthcare providers is the independent or the private sector. Again, here the largest market share is for what we call private acute medical care, that's hospitals and outpatient facilities. And again, the market was worth a significant amount of money. Remember, I said to you right at the beginning that although the UK government funds almost 80% of healthcare delivery through the NHS, that remaining 22%, 20-22%, is funded either through or delivered either through these independent or private healthcare providers and the third sector. So it's still quite a significant market. And again, it's not just about hospitals and outpatient facilities, but I mentioned to you at the beginning, IBEX Medical Analytics. They have just recently partnered with a UK independent pathology provider, and that's a great result. So lots of interesting things going on in the private sector as well. And then some of you may or may not be aware of this, but we have a big charitable sector in the United Kingdom, and it's called mainly the voluntary or third sector, and these are basically not for personal profit organisations, and they deliver lots of different services. They deliver health services, they deliver social services, they deliver research, medical research, and some of them have a not inconsiderable budget. I couldn't find any more recent information, but these 4 organisations had an income of over 100 million just a few years ago, and they provide health services. They work very much in collaboration with the NHS, and what I would say to you here is the UK government is very keen on these organisations, and they are promoting joint working between this sector and public funders of health and care services. So again, a not insignificant market opportunity. And my last group of organisations that I wanted to talk about is sectors transformation. And this is really important because the circle of influence is changing in the UK. Along with probably many other countries in the world, there is a recognition now that a lot of poor health outcomes are due to poor social care factors. And if we actually get social care and healthcare organisations working together, planning things better, making services more joined up, we might actually get better health outcomes. And this is what is happening in the UK at the moment. So there are 2 new players on the block. We have integrated care systems and primary care networks. And this is important because prior to COVID, there was a deadline, if you like, for the whole of England to be covered by an integrated care system by April 2021. That is important, and I don't know, that deadline might change now because of COVID, but it probably will happen at some point in the not too distant future. It's important because the commissioners, the clinical commissioning groups that we have, are likely to reduce significantly in number and may possibly just be one clinical commissioning group within an integrated care system. So the people that you need to influence are changing, and you need to really keep abreast. I mean, change happens, all the time in the NHS, but this is an important change at a system level and one that you need to be aware of. And also our GPs are changing in the way that they deliver care to the local population. So instead of having 7,000 or around 7,000 GP practices working in England in a totally independent way, they're now working together in small groups. So we have about, I think, approximately 1,250 primary care networks in England who are providing medical services at scale and pace to their local geographical population. So it's important for you to, again, sort of light up the way and to open up the imagination of these emerging organisations to what you can do for them and how you can help them to improve health outcomes in the local population. This is a really busy diagram to which I again want to acknowledge the King's Funds. They've allowed me to reproduce this here. It's a kind of busy diagram. Don't look at it now, but there is one key message that I guess I want to convey to you, and that is that in 2018-19, this funding here, £130 billion that came from the UK government. The important thing to note here is that nearly 2/3 of it, £84 billion, went down to clinical commissioning groups to buy health services for their local population. And having just spoken about sector transformation and how things are changing, in 2021, next year, and the years ahead, the circle of influence might be slightly different, and it might not be certainly 135 CCGs having that money, but it might be a smaller number, or it might be integrated care systems. So you do need to keep on your toes about NHS organisation and changes. Okay, how are goods and services procured in the NHS? So I mentioned before that if you do decide that you want to sell to the NHS, with the huge prize of, a population of 66 potentially million citizens across the whole of the 4 countries of the NHS, then there are 5 main routes to market. I don't have time to talk about them now, but with many thanks to my colleague Linda McGee, I'm just going to play you a couple of her top tips, which she's kindly shared with me.
Procurement in the NHS. Top tips for health technology companies. Don't forget the basics. Understand 1, where your product fits in the care pathway. 2, who will use it and who are the stakeholders. And 3, what benefits your product brings to the NHS system. For more established types of products with additional benefits, see NHS supply chain. For innovative new products, register on Health Tech Connect.
Okay, good advice from Linda. I now want to move on to talk about the social care sector very briefly. I mentioned to you right at the beginning that the government funds some services within the social care sector through a combined department, the Department of Health and Social Care. What I want to say right at the outset is, in contrast to healthcare, we have, in England, we have no universal government-funded social care sector. Now, that's not the same in the other countries of the United Kingdom, but in England, there's no universal level of service at the moment. That may change in years to come. What happens at the moment is this government spend of 22 billion or approximately really is targeted at those patients with the highest social need and the lowest wealth. It's a means tested system of basically assessment of local citizens. But this is a really exciting sector at the moment because change is afoot, because there are lots of challenges here, and challenges bring opportunities. We've seen this government, our new government in England, is totally committed to reforming the social care sector, and that was true before COVID happened. But now, since COVID, and seeing that so many of our citizens unfortunately died within the care sector in England, there is now a huge a demand almost for reform in the sector, and that brings with it huge opportunity and a huge potential really to support our most vulnerable people in society. So some of the challenges, I mean, having worked in the sector myself not so recently, when I say there's limited digital infrastructure, I mean in some care homes that we have in the UK, there is no Wi-Fi, let alone even a computer. It's as bad as that in some places. So again, there are opportunities to improve digital infrastructure, to improve the uptake of technology, and that will help us create an evidence base for interventions. It will also help by improving the digital infrastructure. It will help to improve communication across health and social care, and also to make sure that services are actually much more joined up for the local population. It'll enable us, and the use of technology, some of the smart technologies that are so well developed in Israel, have a real place for helping to keep our citizens safe and secure and independent in their own homes for longer. So there's a huge potential here, and I feel really kind of passionately about that. And I think also that the thing to understand is, with the move towards integrating health and social care in the United Kingdom, and with the formation of our integrated care systems, which I just talked about, and our primary care networks, there's really much more potential for things to be joined up, and for technology in these big digital infrastructure projects to succeed, for kind of the integrated care systems to almost redesign care pathways, to embed digital and disruptive digital innovations. So the time is right. These things are going to happen in the next, next not too distant future. And it's really, I think there's a great opportunity here. So what are your routes to market in the social care sector? Well, it's quite similar to the routes to market for the healthcare sector. We have independent or private sector providers. We don't have, at the moment, we don't have a sort of a national social care provider, although some councils, some local authorities do provide some of their own services, but in a very limited way. Mainly we have independent or private sector providers, so those that provide domiciliary home care, that is social care support, activities of daily living, support with that, to people in their own homes. We have residential care providers that provide care to people who are living in residential facilities. And we also have some digital telecare providers. And this is an example of a recent UK-Israel success where Essence Group have partnered with a UK tech business to bring their telecare devices into the UK. And again, the voluntary or third sector are suppliers here, and these are some kind of household charities that also deliver social care services. So there are quite a few providers there. I wanted to kind of finish off my presentation by just spending a minute or two talking about cultural differences. There's an Israeli way of doing things, there's a British way of doing things, they're very different, and there's an NHS way of doing things. I think it's really, really important to be aware of NHS culture, to be aware of the importance of value for money in the NHS, to understand the importance of saying what you mean. So in the NHS, I suppose in the UK, if we say something, we really mean it. So don't run the risk of over-promising and under-delivering. It doesn't work from my experience in the NHS. If you say you're ready, that means you're ready. You have the right evidence, you've complied with the appropriate regulation, you are aware of relevant policies, national policies, and you comply with them, and you've got your house in order, basically. It doesn't work to try and take a shortcut with the NHS, but the prize is that if you do things correctly, it is a great organisation, and the potential to sell your services across a huge, population, is the prize. So it can be done, but do be mindful of the cultural differences. And just to finish up, I want to go back to my first slide with my tips and tricks for success, and summarise. So I said to you, first of all, understand where you fit in. I've given you a real whistle-stop tour, but I hope it's kind of top line enough to be, that you can understand it, that you understand the potential of the health sector or the care sector and the differences, that you understand that to bring your product, your technology successfully to the UK, you need to identify where there is a UK need for it, and not only just in England, in the country, but specifically locally, which local commissioners have identified the need for your area as a priority. Again, we've talked about the role of influencers on strategy. So remember being aware of the regulators and also the policymakers in the UK, and that they really you should be thinking about those early on in your UK strategy. We've talked about the range of sales opportunities. Again, there are opportunities in both sectors, health and care, in the NHS and the NHS family, in the healthcare primary healthcare contractor professions, also in the private sector and in voluntary and third sector organisations, and that's again in both health and care. So hopefully you have a kind of top line view of where you actually fit in. And again, I'll remind you what I said right at the beginning. There is, invest in a bespoke UK strategy. Don't fall into the trap of what works in America will work in the UK. It just doesn't float that way. You really do need to invest, time, skills and resource in developing tailoring your strategy to a UK sales. Remember the 4 countries. Things are slightly different in England, Scotland, Wales and Northern Ireland. Be compliant, demonstrate high quality evidence. I think the thing that's most important to me is, and that's brought me most success in my commercial career, is supporting users in the workforce. And if you take an educational approach, and remember there are standards for training, both in the health and the care sector, that really adds value to your sales strategy. And last but not least, regularly review the route to market. Things are constantly changing in the NHS, and you need to adapt your sales strategy accordingly. So I hope that's given you a kind of really top line view. My contact details are here. I'm happy to take questions, Sam, now. And, if we don't have time to deal with all your questions today, then we can deal with them at a later stage. Please be in touch.
Thank you very much, Sharon. Do people have questions? I know that 2 things came in on the Q&A. Can you see those, Sharon?
I did notice there were 2. Let me have a look. Okay.
And if anyone else has anything, then please feel free to start typing them into the chat or the Q&A, whichever is more comfortable.
Okay.
And if these aren't things that you can address, then that's not a problem.
Okay, so Yoav has asked a question about speech and language therapy. That's a very local issue. One of the things that I didn't say in my presentation is that we've talked a lot about the organisations. Unfortunately, there are, in different organisations, local organisations, there are different structures. So speech and language therapy is a particular specialty. You need to go down to a very local level, usually a community, an NHS community trust would be your best bet. But I would say, to answer that question, it is very niche. So just send me an email, be in touch, and I can, just point you in the right direction. Somebody's also asked about a pilot. If a pilot needs to be done, what is the process? And again, I would go back to what I said about testing and scaling. And there are academic health science networks which are really good contacts, and it depends whether it's a pilot, what you're talking about, if it's a medical device or whatever. But again, come back to me, because there are different organisations. Health Tech Connect, as Linda mentioned, is really an important one if it's digital technology. Academic health science networks, they are good contacts for testing and scaling in the UK. So I'm just looking, I can see bottom up, what advice would you have bottom up approach? Okay, somebody's asked about selling low-cost digital products directly to individual hospital departments. What I would say about that is that in the NHS procurement, so the NHS is moving to getting most of its products now procured through the NHS supply chain. It's a digital product. It may, okay. When I look most recently, there is about 40% of procurement in the NHS goes through in the NHS supply chain. And I think going forward, that is the best route. The they're wanting to approach around 80% of the supply of products in the NHS through the NHS supply chain. So you can look that up easily online. But in terms of low-cost digital products, again, it depends what it is. It's quite difficult. I'd need to give a kind of I'd need to know a bit more about the technology to signpost you. But again, I'm happy if you email me to point you in the right direction. Right, somebody's asking me, given such a complex system, do you reckon? Okay, good question from Roy. Roy has asked, or you can see it, given such a complex system, do you recommend going alone or partnerships? And again, I think it depends on the size of your company and what your product is, and you know, what your timescales are, I guess. It's probably easier to partner with a UK-based organisation. But having said that, given that it's such, you know, is it a complex system? Okay, I mean, I'm from the UK and I've worked in the sector. I hope that I kind of conveyed to you, it's not as complex as maybe you think. And with the right advice and support, you know, you can work the system, but I think you need to invest, you know, you need to invest in preparation. We have a, you know, saying in England, fail to prepare, prepare to fail. And I think that, you know, that is true. I think if you want to go it alone in the UK, you need to invest. And if you invest, you know, wisely in the right support, in the right information, then, you know, you may well be able to go it alone. But, you know, if you just want to dip your toe in the water, depending on the product and the technology, then, you know, there are lots of different other routes that you could do to try. So I think there are pros and cons of both approaches, to be honest. That's all the questions I can see, Sam. Have I missed any? Yeah.
No, that's so. If there are no more questions anymore, no, that's it. Sharon, thank you very much for giving up your time this morning. This has been very interesting and very informative, and we will be sending out a feedback form that you must complete to get access to slides and the recording of today's webinar. So no skipping to the end, please. It's very important that we understand how on point we were with the information that we're trying to deliver to the ecosystem. So thank you very much, everybody, for coming this morning. Thank you very much, Sharon. And we'll leave that there. Thanks.
Bye.